Okay, so this is really how it is. Same hospital, same day, same doctor, same minor surgery, 3 different prices. For the older guy using Medicare, it costs $2,500. For the lady who doesn't even have insurance, the hospital gave her a cash price of $3,300 after negotiations. But you have insurance, so the hospital charges your insurance $13,491. But there's a problem. Your plan has a $4,000 deductible. So you have to pay that deductible, so you end up paying more than the surgery is technically worth based off that negotiated cash price. And honestly, this is minor. Studies show extreme price variations for the same surgeries and treatments at different hospitals. Let me give you an example. The median rate for a coronary bypass is $68,194. But negotiated rates charged to patients who had to get a coronary bypass, ranged from $27,000 to $247,000. What does that even mean? Well, if you get the exact same surgery at the exact same time as somebody else, you might pay $220,000 more because you chose the wrong hospital. In this video, we're going to get into how this is even legal, see if a few AI companies can solve this problem, or if increased price transparency might make no difference whatsoever. Let's dive in. At the University of Mississippi Medical Center, a colonoscopy costs $2,144 if you have insurance with Aetna. It costs $1,463 if you had Cigna, and only $782 if you had no insurance. Why? This is an example of healthcare pricing working exactly as it was designed to. For insurance companies and for hospitals, it's all about who holds the most power. And I do want to say here, I'm not sure if anybody said, hey, let's make this completely unaffordable for Americans. But what some people did say was, let's make this less transparent so that nobody knows how much we're really charging and how much we're really profiting. So how does hospital pricing work? Well, for most people, those on their company's insurance plan, it's based off negotiations. Every single company negotiates their own rates with every single hospital. The problem with all these deals is that they're negotiations. And in all negotiations, if you want more money, you have to start higher. Take salary, for example. If you're in an interview and a job says that it pays $60,000 and asks you, what have you made before? You're probably gonna say something like 65 or 70. And then you negotiate up ideally to somewhere around that 65 or 70. And the same is true for healthcare negotiations. Hospitals have a sticker price, what they call a charge master price, that starts the negotiation. Basically, they say a colonoscopy costs them $5,000. Then the insurance company comes back and they try to get that price down. Simple enough. But here's the problem. It's been confirmed that hospitals often list prices 2 to 4 times as much as it actually costs for them to perform a service. That way, if they lose the negotiation with the insurance company, they still make money. And previously, hospitals and insurance companies were very secret about these deals. We'll get into that in the next section. But what actually determines why some hospital services cost more than others? Well, like I said, it's all about power. If a hospital is popular or the only one around, they've got leverage. They can charge more because insurance companies want to be able to say, yes, of course you can go to that hospital on our plan. And then they'll get more people to enroll in their plans. On the other hand, if an insurance company is massive and they have lots of people already enrolled in their plans, and it can send those people to the hospitals, that insurance company can pressure hospitals to accept lower rates. And that can be one of the major reasons for prices swinging. Sometimes a hospital just has more brand power, or an insurance company just has better negotiators. But I think the wildest part about all of this is that negotiations and pricing were all completely secret until 2021. In 2021, federal regulators finally confirmed what every US consumer already knows: there's a major problem with healthcare pricing. So they passed a new rule that forced hospitals to start posting their prices online. It sounded promising, and hospitals had to publicly post 2 different things. 1, the lowest and highest prices they negotiated with insurance companies for every service. And 2, a simpler list of at least 300 shoppable services. So things like x-rays, MRIs, blood tests. In theory, this would let patients check what hospitals charge before they get care. But the reality was there was 3 major problems that never made that a possibility. First, there was no format. Some hospitals posted PDFs, others uploaded Excel files with thousands of rows, technical codes, and links that didn't work. So let's say you even found those documents online, you're not price shopping. Second, some of the data was just plain wrong. One report from one hospital list found that a joint replacement surgery was listed for $1,000 with a certain code. On a different page, that exact same code listed the service as $1 million. And third, the penalties for breaking the rules were just $300 a day when the rule first went into effect. So for those really big hospitals that are technically nonprofits but still pay their executives over 7 figures, $300 a day was nothing. That might be less than what they charge for a single MRI. So many chose simply to pay the fine and then keep patients in the dark. But ultimately, many hospitals have begun to comply with these regulations as those penalties have gone up. So now that we have that data, or at least a mess of that data, can AI help us more than regulators could? So technically many hospitals did follow the rules and post their prices online. But what everybody got was kind of unusable unless you were completely immersed in the industry. And part of me believes that it was supposed to be unusable. But there have been a few tech companies that have stepped in to try to address that challenge and quietly start fixing what regulators couldn't. Turquoise Health built an AI system that crawls hospital websites. It pulls down all those files and then it tries to make sense of them. Their tool uses machine learning and large language models to read hospital and insurance files, clean, messy data, and then try to extract key terms from contracts. Here's what I mean. It didn't matter if one hospital called a service CT ABD with contrast and another called it CT scan abdominal with dye. Turquoise system has been trained to recognize that that's the exact same thing and then line up the prices. And another cool thing that they did was actually make a public site where you can search something like MRI, knee, or childbirth delivery and instantly compare prices across hospitals. You don't really actually have to know the medical codes, which is nice. And another tech company, Clarify Health, took it further by combining that cleaned up data with real claims from over 300 million patients. In 2004, they launched something called the negotiation opportunity. It shows where payers are getting charged way more than the going rate. They gave an example of one health plan that found that it was paying 30 to 40% more than others for the exact same procedures. And then it used that data to renegotiate and save them millions. So let's get back to the main question here. Can these AI tools change the variability of hospital pricing? On a widespread scale, probably not, but on a case-by-case basis for an employer who has tons of employees on their health plan, it may be able to help them in the future. The one good thing is that there's some real progress toward making hospital pricing more transparent. And that is without a doubt better than it being a big secret like it was just a few years back. If you found this video interesting and you'd like to see more in the future, please consider subscribing. This is Tyler Dutchover. Thanks for watching.